Hello! I'm Sister Babesuhka.
And I'm Sister Alaska Lott,
And this is Utter Nunsense.
the show where we pour a piping hot cup of tea
And utter whatever nonsense pops into our heads.
And it seems like today we have a very special guest.
Hello, I'm Postulant Mairi Me.
Hey!
Open to all offers of marriage.
And welcome to the show, Postulant Mairi.
And welcome, audience, to the brothel house where we're arranging marriages.
If anyone would be interested in marrying Mairi Me, pop a comment down below.
Or you could bury £1,000 in your garden and one of my underground agents will contact you.
So many options. Today, we will embark on a journey to shed light on the myriad of challenges faced by trans people as they navigate the healthcare system fraught with barriers and inequities.
For far too long, trans individuals in the UK have been met with systemic discrimination, institutional barriers, and a profound lack of understanding within the healthcare system.
From the initial steps of seeking a referral to gender identity clinics to the daunting prospect of navigating lengthy waiting times and invasive assessments, the journey towards gender-affirming care is rife with obstacles.
But beyond the logistical challenges lie deeper issues that perpetuate the cycle of marginalisation and neglect faced by trans communities.
The impact of these barriers extends to affecting the mental health, well-being, and overall quality of life of trans individuals.
As someone who has personally experienced the frustrations and indignities of attempting to access trans healthcare in the UK, I can attest to the profound impact it has on one's sense of self-worth and dignity. The struggle for trans healthcare is not just a matter of physical health, it's a matter of fundamental human rights and dignity.
So today we invite you to join us as we delve into the heart of this complex issue, exploring the root causes for the barriers to trans healthcare, examining their impacts on individuals and communities, and envisioning a path forward towards a more inclusive and equitable healthcare system for all.
Let us embark on this journey together with empathy, compassion, and a commitment to justice as we discuss the struggles for trans healthcare in the UK.
I'm a trans woman. My pronouns are she, her. I'm quite out about being a trans woman. I've been out since October 2022. Of course, many years of soul searching before that. I first sort of realised that my identity was probably trans back in the early 2000s. That's how long it took.
So I'm coming into this conversation from this perspective of being non-binary. So my pronouns are they, them, and I'll also accept cunt and bag from time to time. And yeah, from my perspective, I've never had to access much in terms of gender affirming care from the NHS in Scotland, but it is something that still matters to me as a sister and as someone who wants equality for all.
I also am a non-binary person. I accept any and all pronouns, use them all, mix them up. It makes me very happy. And like Sister Babesuhka, I have never attempted to access trans healthcare myself. In fact, I don't attempt to access healthcare at all because I've had some terrible experiences. I've simply given up. But I also care deeply about other people's experiences of accessing healthcare and the profound impacts that it can have on people.
Some trans people are very concerned about being identified as trans. Not everyone is as open as I am, but I just accept that, that having started the process so late in life, it's pretty inevitable that my past will catch up with me at some point, so there's no point in trying to hide it.
I feel there's a really important conversation, probably for a different episode, around passing, conversations around passing, and how passing is not the point. It's about living as who you are and living your truth and stuff it. If people think you pass or don't pass, it's nothing to do with them. It's not their business. I don't owe you passing. I don't owe you non-binariness. I don't owe you anything.
Yeah. Oh, passing. We could spend hours on it. We really could.
Let's delve deeper into the intricacies of accessing gender affirming care within the NHS in the UK. And I'm going to hand over to Postulant Mairi for this. Could you maybe shed some light on what the supposed process for trans individuals is supposed to be for seeking medical transition?
In theory, the process begins with a visit to your local GP, who is then supposed to refer you to a gender clinic for assessment by specialists. Although, in my case, mine was done by telephone appointment. And then, of course, they asked me, so what's the appointment for? At which point, I'm just like, it's for a referral to a clinic, was all I told them. Because, of course, I didn't want to tell the receptionist. Basically, the first thing I said in the appointment was, I'd like a referral to the gender identity clinic, please. And then there's a pause on the phone, and she goes, okay, we can do that. Asked for a copy of my referral because I'd heard horror stories about people putting in referrals and then the doctors don't actually process them.
Mm-hmm.
So I made sure I got a CC of my referral, and it did go through. I'm now maybe about 2 or 3 months away from being seen, at which point they will hopefully diagnose me with gender dysphoria. I would certainly hope so, having been socially transitioned since October 2022. Then I'll be able to access hormone therapy on the NHS. I am currently on hormone therapy, but I'm paying for it privately because of the NHS waiting times.
I'm really impressed that they said yes straight away, because I too have heard so many horror stories about people who've been told no, or being told come back in 6 months and see if you still feel trans. Like really ridiculous things. So it's really lovely to hear that they said yes, and they actually made the referral, because I've also heard about people who've been told yes, we'll refer you, and then they don't do it. So actually, it sounds like you got quite lucky with your doctor.
Expanding on what you said, one of my friends, she's now gone through the whole process, hormone surgery, etc., but she was stalled by her family doctor in her hometown for several years.
That's abhorrent.
How difficult for her.
Like, it's all about bodily autonomy, and it shouldn't be a case of them dictating, oh yeah, we'll make a referral, or oh, we won't make a referral till you jump through hoops.
GPs are supposed to be a gateway to other NHS services, and it's really sad that so many of them act as a gatekeeper rather than a gateway. They're not there to say yes or no. They're there to make sure you get referred to the right place.
So, in theory, it sounds straightforward, but the reality often fails short of expectations, as is many things in life. The truth is that the journey from initial consultation to receiving gender-affirming treatment is fraught with barriers and delays, leaving many trans individuals languishing in limbo for, unfortunately, it is years. And often, as we've talked about just now, GPs lack the training or are simply unwilling to make the referrals, even though that's kind of what they're there to do.
The disconnect between the idealized process and the lived experience of actual trans individuals really speaks volumes about the systemic shortcomings within the healthcare system. And Postulant Mairi can probably elaborate more on the expectations actually set for trans people when seeking medical transition.
Oh boy, could I. The NHS claimed to uphold the principle of timely access to gender-affirming care with a maximum waiting time of 18 weeks for initial assessment and treatment. However, the harsh reality is starkly different, with waiting lists stretching far beyond the prescribed time frame, leaving many individuals in a state of limbo and distress for years. Now, 18 weeks that's 4 months. I have now been waiting on Chalmers since September 2022. So by the time I get seen and actually get a prescription from hormones from them, it's likely to be September 2024. And the sad thing about this is that Chalmers actually has one of the shortest queues in the UK.
I was going to say, like, 2 years is such a long time, but actually, I've heard of waiting lists far longer than that, with people waiting 8 years. Some lists are predicted to be even longer than that by the time people actually manage to get their doctors to refer them.
There are two main clinics in Scotland. There's Chalmers, which is based at Chalmers Hospital in Edinburgh, and there's Sandyford Gender Identity Clinic through in Glasgow. Sandyford, according to their website, are now seeing people who were referred in November 2018.
Oh,
I know people from Glasgow and I feel bad for them. If you are referred to Sandyford, you have no choice in the matter. The only way you get any choice in the matter is if you physically move and go to live in Edinburgh. People have actually done this. People have moved to Edinburgh to take advantage of the shorter waiting times at Chalmers. People have lied and said they live in Edinburgh to take advantage of the shorter waiting times at Chalmers.
It's creating its own horrific postcode lottery for people to have to try and game the system, which is totally not what healthcare should actually be doing.
I think it's worth mentioning that this, although we're talking about accessing gender affirming care, this actually extends wider, and accessing care in the NHS in general can be difficult, and waiting times for other services can also be long. Maybe not quite as long, but I remember waiting for, well, I didn't wait, I ended up paying privately, but I remember being told that if I wanted an operation on the NHS on my spine, because I have a degenerative condition, I was going to have to wait for 3 years to be seen. And I was in too much pain to go on for 3 years on that level of pain. So NHS waiting times in general are a bit shit.
Even my electrologist told me a story of one of her relatives, I think it was her uncle, who was waiting to get I can't remember if it was getting a pacemaker fitted or even just getting the battery changed, and died waiting for that. People die waiting for NHS treatment because it's so low.
There's the mental health side of things, which I think is important to recognise. And one of the reasons that I couldn't wait 3 years for surgery that I needed.
It's almost as if 14 odd years of conservative leadership, as well as stupid things like Brexit and other harmful policies being put in place, have been more of a hindrance and a damage to the NHS and ensuring that people can access public services.
Really?
Really?
Shocking.
Fucking vote them out.
Let's kick out the Tories. The enemies of this land.
When you're talking 2 to 8 years for people, it really does undermine that trust that people have in the healthcare system to actually provide what they need. But as we're saying, it's also going to have an impact on people's mental health and the challenges that they're going to face, both for trans individuals. But as we've said, for overall healthcare, having that delay it is deadly.
I'm lucky in that I have a fairly high income for a single person, so I was able to go off and seek private services. Other people can't exercise that option, and there are thousands of people who are self-medicating, who are buying injectable estradiol valerate off the internet. The problem is that these people are unregulated, unmonitored. They have no idea if they're running potential side effects. Although, to be honest, the worst side effect you can have from too much estrogen is blood clots, and a lot of these people are young, and therefore they're less likely to run into that as a complication. But older people my age who self-medicate are at significant risk if they're unmonitored, especially if you don't check your prostate first.
I can completely understand why people would turn to self-medication. They're essentially weighing the risks and benefits, and when you make people wait so long, they're at risk of not surviving long enough to get to their appointment. What else are they going to do?
My partner works in healthcare. Obviously, the NHS cannot officially condone such things, but from her perspective, that is a person that is in need of treatment and in need of help. And so even if they're self-medicating, she is still advised that you might want to inject here or there, you might want to do this or that when they've been unsure. So even though she can't officially do anything on that side of things, with the mental wait times that are going about, she can make that small difference.
I'm glad to hear that that sort of thing is happening, even if it's unofficial, because one of the problems with people self-medicating is, as you just pointed out, harm reduction. Nobody's teaching these people how to do it properly. They're learning off of internet forums and off of peers. some of whom are more experienced than others. You can get some excellent advice on the internet, as you know, and you can also get terrible rubbish.
I mean, at the end of the day, if you've signed up to be in the NHS, you have signed up to help people and alleviate that suffering, and you have signed up to that harm reduction mindset. So really, it feels like everyone in the healthcare system should have that feeling of duty to helping people.
The General Medical Council's own advice is that if people are self-medicating, then on a harm reduction basis, you're supposed to give them bridging prescriptions, i.e. access to hormones, prior to the initial appointment with the gender identity clinic. But most doctors won't do this. Doctors are reluctant to do bridging prescriptions because they're worried about being sued by detransitioners. It's just led to a complete block in healthcare for people until they actually reach gender identity clinic or pay to get it done privately like I did.
I would question how many times a detransitioner has actually sued someone for giving them the medication that they asked for. I feel that's more likely to be an imagined fear rather than a real risk.
Exactly. And a lot of detransitioners who've gone past social transition and started medicating, not of course that you have to medicate to be trans, that would be trans medicalism to say that's compulsory, but people who start medicating and stop medicating, generally it's not because they decided, oh, I don't want to be trans anymore. It's social pressure from family, friends, employers.
Yeah, like when you look at the actual statistics, the number of people who detransition is so low. Like transitioning has got one of the highest success rates out of any medical procedure you can think of. And even when they do detransition, it's often because of backlash from societal pressures rather than because they've decided they're not trans. And a good number of them will go on to retransition again when they feel they're in a safer place or have the support that they need.
Prolonged delays not only perpetuate feelings of dysphoria and distress, but also have tangible consequences on trans individuals' access to civil rights and opportunities in various facets of life. Everything from renting property to starting a new job requires you to out yourself if you haven't been able to get the gender marker, been stuck on the waiting list for years.
If you want to change the mark on things like your passports, you actually need a doctor for that to sign it off and say that you can do that, which is ridiculous because you can socially transition. The second someone asks for something like your passport, if your doctor hasn't agreed, it kind of gives the game away.
A lot of landlords now will ask for passports as proof of residency, so
Yes.
Yeah.
same as starting a new job now, because they changed the law since I started my job.
And of course, once individuals finally navigate through that labyrinthine waiting list and secure that long-awaited appointment at the gender clinic, the ordeal is far from over. These appointments often entail really invasive and dehumanizing interrogations about the most intimate aspects of your life. It's genuinely so difficult.
Sadly, however horrible that is, it is true that trans individuals are subjected to a barrage of probing questions that delve into sexual history, childhood experiences, and even some of the most private thoughts and desires. I think half of the questions don't even have any bearing on being transgender and means the process is actually quite degrading as an experience that strips away autonomy and actually reduces people and humans to mere objects of scrutiny.
This is going to be an interesting thing for me because I haven't actually been formally diagnosed by the NHS. I've been diagnosed privately. The private diagnosis process wasn't really that invasive, so it's going to be interesting to find out in a few months how the NHS process does compare and whether it's as invasive as you said. Intrusive assessments like that not only violate the privacy and dignity of trans individuals, but also perpetuate harmful stereotypes and misconceptions about gender identity, and reinforce the notion that being transgender is a condition to be pathologized and scrutinized rather than a valid expression of one's identity. Yes, it's seen as a sexual health matter and does not have a psychological component to it at all, according to the latest standards. Yet in the UK, they still insist on diagnosis by psychologists.
And I suspect that people's experience will depend where in the country they are as well. As we've already discussed, you can get a different experience from one city to the next, from one doctor to the next. So what that person has to go through in order to get that diagnosis may very well vary across the UK.
There's probably an element somewhere in the private organisations can be a little bit more liberal, and they can be a bit more focused on getting to the end point of the journey, because at the end of the day, they've been paid. They just need to do the thing that they've been asked to do, which is make the referral and do the fucking job they're paid to do. Whereas maybe with the issues that we've talked about on the NHS side and the underfunding, understaffing, etc. But as well as that, having these antiquated methods because of leadership in the country.
And of course, this very process, which is meant to facilitate access to gender-affirming care, just ends up re-traumatizing and marginalizing trans people. And it just further compounds the challenges that they already face in navigating a cis-normative society.
It's a vicious cycle, really, of discrimination and dehumanization that really underscores the urgent need for radical reform within the healthcare system. And unfortunately, it's not the only government process that seeks to dehumanize those asking for simple assistance either, which is, well, that's also really disheartening, isn't it? That government's trying to dehumanize people in multiple ways. Yay.
So I think maybe it's time to explore potential strategies for challenging and dismantling these harmful practices and advocating for a healthcare system that actually respects and affirms the dignity of all people, regardless of their gender identity.
The repercussions of the obstacles that we've been highlighting just now extend far beyond the confines of the healthcare system, and they do actually permeate various aspects of trans individuals' lives. Postulant Mairi, could you maybe shed some light on the ripple effects of these systematic challenges?
Basically, the barriers to accessing gender-affirming care create a domino effect of challenges for trans people, amplifying feelings of dysphoria, anxiety and distress. Beyond the immediate impact on mental health, these barriers also hinder trans individuals' ability to fully engage in society, pursue education and employment opportunities, and maintain healthy relationships. The cumulative toll of navigating a system that fails to affirm and support their identities takes a significant toll on the overall well-being of trans individuals and contributes to higher rates of mental health disorders, substance abuse, and suicide within our community. There's also the issue of non-binary individuals who are poorly catered for. There's no option within the NHS to be non-binary.
So, Sister Babesuhka, what do you think we could actually do to mitigate these challenges and address the systemic shortcomings within our healthcare system?
I think one crucial step towards addressing these challenges would be the implementation of comprehensive policies and practices that actually prioritise the needs and the dignity of trans patients. This includes ensuring healthcare providers receive adequate training on what trans-affirming healthcare should be and cultural competency, establishing guidelines for equitable access to gender-affirming treatments, and actively involving trans individuals both in the design and the delivery of healthcare services. So by centering trans voices and experiences, we can actually create a more responsive and inclusive healthcare system.
There's some interesting points there, and I'm sure that will segue into our later discussions about the CAST report, especially what you mentioned about excluding trans people from discussions on healthcare, something which Dr. Cass deliberately did.
It was an interesting choice, wasn't it?
Education and advocacy initiatives can play a pivotal role in challenging misconceptions, combating discrimination, and fostering greater understanding and empathy towards trans individuals. By promoting visibility and advocating for policy reforms, we can work towards creating a more inclusive and affirming environment for all members of our community, including non-binary individuals.
I absolutely agree. I feel it's imperative that we work collaboratively to dismantle the systemic barriers that hinder access to gender-affirming care and perpetuate health disparities within the trans community. By advocating for policy reforms, investing in trans-inclusive healthcare services, and amplifying the voices of trans individuals themselves, we can strive towards a future where healthcare is truly equitable and affirming for all.
Through concerted action and solidarity, we can create positive change and ensure that trans individuals receive the dignity, respect, and care that they deserve. That's why we must continue to champion trans rights and challenge systemic inequalities.
The main barrier to equitable trans healthcare in this country is this country's whole antiquated gender identity clinic system. There aren't enough of them, they don't have enough people, and their diagnosis times are unacceptably long. Other countries have adopted less centralised systems where, general practitioners just prescribe the hormones. And I would hope the UK could move towards something like that, but it's not going to happen anytime soon. The standards that they go by were written in the 1980s. They were based on conjugated estrogens, which is basically boiled horse piss.
Boiled piss!
That's where the boiled piss has been, Alaska.
The point is that conjugated estrogens contain chemicals that are likely to cause blood clots. Modern synthetic estrogens, such as here, do not contain ethinyl estradiol, which is the bad chemical, yet the standards are still written as if this stuff was semi-poisonous. I can't really comment on the trans mask perspective as I'm not going through that journey, but I would not be surprised to find out it's equally poorly informed and based on outdated standards.
What I also think is worth noting is that cis people can access the same drugs without the need to be referred to a clinic. They can be often just prescribed from their GP. So if a cis man needs testosterone to help with a medical issue, their GP can just give it to them.
Exactly, and they just will not do this for trans people.
And I don't understand why we're making trans people specifically jump through all these extra hoops, taking up lots of extra time, lots of extra money, lots of extra resources from the NHS when they can't afford any of those things. But you're not doing that for anyone else. Like, why can't we just treat everyone equally and say, you can just get it from your GP? Thank you very much.
Also, the blatant transphobia recently that we've just seen in the last couple of days, where the government passed a ban on puberty blockers, but only for those people that would be trans. Cis kids still able to access them, not banned for them, even though it's the same age range and everything else. It's literally blatant transphobia.
If those puberty blockers were that dangerous, why are they not worried about the effect on cis kids taking puberty blockers? Why are they only worried about trans kids? It's got nothing to do with the negative consequences of the puberty blockers. It's transphobia. Which brings us on very nicely to the Cass report, doesn't it?
Of course, we can't talk about trans healthcare in the UK without discussing the recent developments due to the recently released Cass report. This supposedly comprehensive review, commissioned by NHS England and spearheaded by Dr. Hilary Cass, has ignited a significant conversation within the healthcare community and among advocacy groups.
Now, the Cass report was meant to offer a detailed examination of the current landscape of trans youth healthcare. In the report, Dr. Cass underscores the need for a more robust evidence base to guide clinical decisions and practices within trans youth healthcare. One noteworthy recommendation proposed by Dr. Cass is for a more holistic approach and the establishment of regional hubs across England to deliver comprehensive and coordinated care for trans youth.
However, the Cass report has elicited varied responses from experts and stakeholders in the healthcare field. While the Cass report has been commended by some, it has also faced scrutiny regarding certain aspects of its methodology and its conclusions.
One notable point of contention is the assertion that much of the existing research on clinical guidance for trans youth is of poor quality, leading to questions about the reliability of the evidence base used to inform the report's recommendations. Additionally, The report's dismissal of internationally recognised organisations such as the World Professional Association for Transgender Health has raised concerns among experts about the validity of its assessments.
By labelling organisations like the World Professional Association of Trans Health, or WPATH, as poor quality, the report undermines decades of expertise and guidance in transgender healthcare. And perhaps most fundamentally, there was no evidence provided from trans people trying to access gender-affirming care whatsoever. Seems rather remiss, doesn't it?
We feel it's imperative to critically examine the recommendations put forth by the CAS report and consider their potential impact on trans youth. While efforts to enhance access to trans healthcare and prioritise the well-being of young people are commendable, it's essential to ensure that policies and practices are grounded in evidence-based approaches and centre the experiences of trans individuals.
For example, Dr. Tessin Lada, a paediatrician and assistant professor, has rightly pointed out the challenges of conducting perfect research in marginalised communities. The lack of a gold standard study should not be used as a pretext to deny care to trans youth.
And Dr. Jake Donaldson's assertion that withholding care due to a lack of randomised clinical trials is unethical resonates deeply. Trans individuals deserve access to affirming and supportive healthcare, regardless of the research landscape.
This is particularly important because this report is already impacting the provision of trans healthcare around the UK. As we navigate the complexities of trans healthcare policy and practice, it's essential to engage in constructive dialogue and collaboration amongst stakeholders with a focus on fostering transparency, accountability, and inclusivity.
As advocates for trans rights and healthcare equity, we feel it's incumbent upon us to champion policies and practices that prioritise the health and well-being of trans youth. By amplifying the voices of the trans community and advocating for their needs, we can contribute to positive change and create a more affirming and inclusive healthcare system for all. So let us continue our efforts to build a future where every individual has access to compassionate, comprehensive, and equitable healthcare services.
I mean, the whole insistence in the CAS report on double-blind controlled trials seems to be a bit out of odds with how other medical treatments are treated. People should be medically treated when they have a medical issue. And that's purely what this is. You don't really need to conduct a randomised controlled trial to know what the effects are going to be. We know. We know from experience, just like we know from experience that putting a plaster cast in the bone to set it is the best thing to do for a broken limb. It's unethical to do double-blind controlled trials on people. You can't really take a group of trans teenagers and say, we're going to give half of you hormones and not give half of you hormones, because, you know, the bag will be out in about 6 months, which is about how long it takes before definite changes start happening. The ones who are not on hormones will know, because nothing is happening.
It's almost like she was looking for a way to deliberately eliminate all research that supported trans healthcare, because she did in fact eliminate all research studies apart from one, and it was a transphobic one.
And of course, there are the recent changes in the law in the UK, where there was an emergency order made under the Medicines Act, I think it was, to stop young people from seeking puberty blockers abroad and importing them to the UK. This legislation, apparently from a news report I read, was last used sometime in the 90s to block some kind of legal high. That's how infrequently this is used, and it's now being used to victimise trans youth.
This also goes hand in hand with other recent changes. For example, the guidance that came out about not talking about trans or queer stuff at school, which is harkening back to the days of Section 28.
Section 28.
Affected a whole generation of people really negatively.
This is it. It will just lead to stigmatisation.
Yes.
It's almost as if using a thinly veiled transphobic report to enact transphobic policies has been the game all along.
Imagine doing this report and never once actually factoring in actual trans people who are affected by the process. It's like doing a study on ducks, but you never ever go outside to look at a duck or observe a duck or find out anything about like how ducks live and what they eat. Like, you know nothing about ducks, but you're just going to write this report.
All the ducks are swimming in the water, tra-la-la-la-la-la, tra-la-la-la-la-la.
Well, Dr. Cass doesn't know that. She never went to look at them. So, as we wrap up our conversation on the challenges of accessing trans healthcare in the UK, I think it's crucial to highlight the stark disparities between the experiences of trans individuals and their cisgender counterparts. Because while cisgender individuals can often access healthcare without undue barriers, trans people face a labyrinth of obstacles and requirements which can be costly, time-consuming, and fundamentally inequitable.
It's evident that the current healthcare system places undue burdens on trans individuals, forcing them to navigate a complex web of gatekeeping and bureaucracy to address the care they need. This not only perpetuates systemic inequalities, but also undermines the principles of equality and dignity for all.
By recognising the disparities in access to care and acknowledging the additional barriers faced by trans individuals, we can begin to address the root causes of these inequities. It's essential to advocate for policies and practices that prioritise the health and the well-being of trans people, ensuring that they can access gender-affirming care in a timely, respectful, and affirming manner.
So thank you for joining us for this important conversation. And until next time, let's continue to stand in solidarity with the trans community. And together we can work towards a future where healthcare is truly equitable and accessible for all of us. I think everyone's done very well at doing a thing.
A lovely chatting thing.
Then I declare, we did the thing.
We did the thing.
We did the thing. We did the thing. We did the thing. We did the thing.